Right. This is a motion, first motion, that this meeting considers that the Health and Social Care Bill, if passed, will damage the NHS and the health of the public in England. Calls upon the Faculty of Public Health to demand complete withdrawal of the Health and Social Care Bill, and calls upon the Faculty of Public Health to seek an alliance with the RCGP, other medical royal colleges and other bodies to oppose the bill. And if I can invite Alex Scott-Samuel to come and propose the motion.
Thanks very much, Lindsay. Can you hear me okay? I'm like David earlier, I feel delighted and privileged to be here representing the views of so many people, and I have gained and learnt so much from the discussions recently of people around the issues that we're covering this afternoon. Perhaps I should say that I'm not a spring chicken in public health terms, and I'm saying that in order to emphasize the point that I've been thinking about and practicing and advocating around politics of health issues since, well, I've been in public health for 38 years. I've been a member and subsequently a fellow of the faculty for 35 years, and for all of that time I've seen health in a political way, and what I'm talking about this afternoon is simply a continuation of the attempts of many of us to advocate for public health. Okay, well, let's cut straight to the chase. In a debate on health inequalities in Westminster Hall in the Houses of Parliament yesterday, Chi Onwurah, the MP for Newcastle Central, said, quote, "A recent letter to the Health Service Journal, signed by more than 40 directors of public health and more than 100 public health academics, argued that the Health and Social Care Bill will increase health inequalities. If the government will not pay attention to what the opposition say, perhaps they will pay attention to what the profession says. 7 former presidents of the Faculty of Public Health have said that the bill will exacerbate inequalities. So why, you may ask, has it been left to the Magnificent Seven, as we call them, former faculty presidents, and it's great to have several of them here this afternoon, and our hurriedly formed Public Health for NHS group to undertake the public advocacy on the damage which the bill will inflict on the public health? Is this not the faculty's role? Is the faculty's insistence on what Louis Buñuel, the film director, in a different context called the discreet charm of the bourgeoisie, not wearing a little thin? The truth at the present time is that we're in a war situation. The government has declared war on universalistic welfare state policies and services, and the NHS is its #1 target as one of the few surviving elements of the post-war vision. The government, as previous speakers have said, the government wishes to destroy that vision, to change the health service from an equitable system based on social solidarity and available to all into a poor quality public safety net and an expensive, elitist, insurance-driven private market for those with money like themselves. They don't say this, of course, but you've read our 2 background papers. And if you read my letter in last Saturday's Guardian, you'll see a summary in precisely these terms of the best analyses available on the bill's implications. Why is our motion worded as it is, and why did we call this EGM? Just to be clear, by the way, we exercised our right to call this EGM. The standing orders make it clear that even if the faculty had refused, we have this as our right. In the event, of course, the faculty was happy to agree and to organise the event, but it is at the very least disingenuous for the faculty to claim on its homepage that, quote, the board called the EGM to discuss the Health and Social Care Bill, unquote, as if it was their idea. The standing orders make it clear that in the present circumstances, this meeting has been requisitioned by the membership and convened by the registrar, as is his duty when 25 or more members requisition a meeting. That's obviously not what we're here to discuss this afternoon, but I know a lot of people have been concerned about that, so I thought it needed to be raised. We're hoping that you will vote on the clauses in our motions precisely as the North West Faculty Local Affairs Committee did last Thursday. In other words, unanimously in favour of each of the 3 clauses of the Public Health for NHS motion and against the second clause of the faculty's motion. And I'll explain why I say that. The first clause of the faculty's motion, I know different people have different feelings about.
Let's focus on this motion. We'll come to the second motion later.
To speak as I choose, Chair, and I think you should not deny me that right.
Alex, you can respond to the faculty what same as any member at the front, but this is to propose.
It's not possible to discuss our motion without discussing the faculty's motion.
Now,
Could I ask if people agree with me?
I'm sorry, I am chairing this meeting and I am ruling that in proposing this motion, you focus primarily on this motion. I'm very happy for you to speak on the faculty's motion when it comes up later. Very happy.
Well, thank you. Out of politeness, I will do what you say, but my understanding of the rules of debate is that I am free to speak as I choose, and in my view, what I'm saying is relevant to why our motion is worded as it is. I won't say what I was going to say then about the second clause of the faculty's motion because I've been prevented from doing so. With regard to our motion, rather than repeat to you the motion which Lindsay has read out, I'll simply mention some of the conclusions in our document, if I'm permitted to do so. This bill will put an end to the founding principles of the NHS. This bill will negatively affect both public health protection, population health improvement, and individual patient care in many ways. We in public health have an ethical responsibility to defend the health of the public by all means at our disposal, and we cannot effectively defend the health of the public without opposing the bill in its entirety. So that really is the basis for the wording of our motion. Once again, I don't know whether I'm allowed to say this, but reading the faculty's list of achievements in its negotiations with government, I felt like I was reading an account of how the working conditions of those who arranged the deck chairs on the Titanic have been promoted and protected. I'm sorry to raise the Titanic metaphor again. While the achievements would read impressively enough in peacetime, how useful is it in the current context to be reassured that when Lansley's monstrous iceberg has destroyed our NHS vessel, we will have a ring-fenced team of well-placed public health folk ready to work with the fragments that remain of the NHS to meet the health needs of the population. How I wish I was exaggerating. As John Ashton pointed out at our North West FLAC meeting last week, the NHS is a public health measure, one that pools risk across social classes and between the well and the sick. As Martin McKee and David Stuckler described in the Christmas BMJ issue, the government is mounting an assault on the universalism of the NHS and the welfare state, and is trying to detach middle-class support from our welfare system. I'm a diabetic with multi-system complications, and I need a coordinated public health care system to give me adequate care. The government is demolishing this system, and I personally expect the Faculty of Public Health, if I may say so, the professional body that best understands health systems, to stand up and be counted in opposing this. The RCGP, RCN, RCM, midwives, and BMA have shown very clearly, and it's been said earlier today, that bodies which normally promote the interests of a single group are perfectly capable of speaking out when the NHS is attacked. And it's nonsense to say that these bodies will lose credibility with government for what is simply doing their job. I've not noticed the government cutting off contact with any of these bodies. In fact, as someone implied earlier, bullies often respect those who stand up to them. I noted down a quotation from a board member at a recent meeting. Quote, "The faculty has had a very close relationship with the Department of Health for many, many years and has relied heavily on funding from the Department of Health. In what I've called peacetime, this is of course entirely appropriate and normative, but in the present situation where DOH civil servants are in effect forced to defend the indefensible, these facts clearly make it difficult for the faculty to criticise government policy. It's our responsibility and our privilege today to help Lindsay and her colleagues by empowering them with our mandate to speak out against this appalling legislation and to join with like-minded bodies representing medical, nursing and many other NHS staff in advocating for Parliament to reject the Health and Social Care Bill. Once again, I ask that you support all three Public Health for NHS clauses." Sorry, just censoring a bit that I was going to say after that. Meetings with ministers and civil servants are fine when things are going well, but now we have our backs to the wall. We urgently need our faculty to remember the public health tradition, to show its professionalism and use its expertise to speak out on behalf of the people of this country before it's too late and our NHS is lost forever. I was going to start with an epigraph from Gandhi. I don't know whether you can have an epigraph at the end or does it become a postscript. But Gandhi famously said, "Non-cooperation with evil is as much a duty as is cooperation with good." I urge you to support all three clauses of the Public Health for NHS motion. Thank you for listening.